The information on this YouTube channel is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. All content, including text, graphics, images, and information contained on or available through this channel, is for general information purposes only. This channel makes no representation and assumes no responsibility for the accuracy of information on or available through this channel, and such information is subject to change without notice. You are encouraged to confirm any information obtained from or through this channel with other sources and review all information regarding any medical condition or treatment with your physician. What's going on, guys? Pistol Packin' Pilot back with another video, and I am lucky to be joined this evening by the one and only Mrs. Silver and Cigars, the wife of Silver and Cigars. I had contacted Silver and Cigar, or he had contacted me rather, and said that his lovely wife might be interested in having a chit-chat with me about some of the things that have happened to her recently as a result of some of the current events that have been going on. So first of all, how are you doing, Mrs. Silver and Cigars?
As of right now, I'm doing really well. The beginning of the summer was kind of hit and miss, but as of right now, I'm doing pretty good, so can't complain.
Okay, now, as I understand it, and let me preface this by saying this is obviously not medical advice. Anything that I say or that Mrs. Silver and Cigars may say is strictly our opinion. It's not medical advice in any way, shape, or form. But Mrs. Silver and Cigars, I understand that you work in the healthcare industry, right?
That is true.
Okay.
I'm actually a nationally certified nurse practitioner.
Okay, so for those of us who don't know, can you tell everyone what a nurse practitioner is exactly?
Sure. So I work in healthcare, and I basically go in and I see patients the same as a doctor would. I assess you, I listen to you, I ask you questions about your health, I give you medical advice, and I also have the opportunity to prescribe you medications.
So you basically practice medicine under the license of a physician, is that correct?
That is correct.
Okay. That being said, I think it's fair to say that you've probably worked in this field for quite a while. Let's start by talking about some of the things that have happened, like 2019, 2020. We know that they rolled out the magical Kool-Aid, and a lot of people were forced to take that whether they wanted to or not, especially some of your frontline workers and a lot of healthcare workers. So I'm assuming they mandated it for you as well?
That is correct.
Okay, so how many did you take?
I've had 3.
Okay, so the 2 plus an additional 1.
Correct.
Okay, and what happened after you took it?
So with the first one, I got it. I felt fine at first. It was in the morning, and then it's kind of funny the way I remember this specifically, and it's because I was baking Christmas cookies, and I had plans for the entire weekend to bake cookies for my friends and family. And by 3 p.m., I had felt like I got hit by a semi-truck and then ran over, thrown down a flight of concrete stairs, and injected with some type of sedative because I fell on the couch, closed my eyes, and didn't wake up for 3 days.
Oh my God.
I was just completely beat down by it. I ran a fever, I had the chills, I was shaking. It was awful. It was like feeling like you had the worst flu of your life.
Okay, so now let me play devil's advocate for a minute. They did say in the beginning that there were some normal side effects that would disappear very, very shortly after you took it. So you said that lasted for 3 days, right? And then what happened after that?
Oh, you still lived with the body aches and the low grade fever. I would say fully it took about 2 weeks to completely disappear.
Oh,
And
wow.
I'm actually one of the lucky ones. I had coworkers at the time who ended up having to go on medical leave.
Oh, wow.
Because of some of the things that have happened.
Okay, and what did some of them go on medical leave for? Like what kind of issues?
Some of them had very, very bad reactions. Some of them ended up getting admitted. They had cardiac issues. They were having such high-grade fevers that they couldn't get them broken down with medication. So they were dehydrating very quickly. So they had to have IV fluids running constantly. One actually, which said it wasn't supposed to happen, went into anaphylactic shock and had an anaphylactic reaction. And ended up on a ventilator for a couple days.
Wow.
But
You got over the hump within a couple of weeks, but then we know that there was like after 3 weeks, you had to take a second batch, right?
correct.
How did that one go?
That one, I didn't have the flu-like symptoms I had with the first one, but it felt like I had been shot in the arm. And my arm hurt so bad. It hurt to work. It hurt to lift it. It almost hurt to do like day-to-day things. Like it hurt to wash my hair, wash my hands, feed my dog. You name it. It hurt just to move. It hurt just sitting still.
Okay.
So
And then how long did that last for?
that lasted about a week. And then on top of that, I did end up having a pretty sizable, it's about the size of a softball, knot on my upper arm. And it was very, very red, very swollen, very inflamed. I did end up going to have it checked out, and they passed it off as, well, you probably got a spider bite.
Wow, that's a hell of a spider.
So that was their excuse for why my arm looked and felt the way that it did.
And was it one of your fellow physicians that told you that, or?
It was.
Okay. All right. So then that softball lump, I am assuming, eventually went away, correct?
It did. After a couple weeks, it finally completely went away, and my arm went back to normal.
Okay. And then what happened after that?
Then I got a third one.
You were required to get a third one, or was that by choice?
I was required.
Okay.
The facility that I worked at had basically required us all and gave us a deadline to either get all three or face termination.
Okay.
And obviously I didn't want to be terminated. So I bit the bullet and did it. And that one, I believe I got sometime in early October. And again, the reason I'm willing to talk about this is because of the sequence of things that happened to me afterwards. Is on November 11th, I remember being at work and just telling everybody, I do not feel good. Like something is wrong. I can tell something is just wrong. So I left work. I came home. I woke up the next day. I ended up having a very, very high fever. I could not move. I could not get comfortable. As much as I tried, I just couldn't sit still. It literally felt like my bones were breaking from within me. Everything hurt. Just nothing felt right. I had a horrible cough. I had a headache, the fever, the whole 9 yards. So Mr. and Silver and Cigars took me to a doctor. They looked at me. They didn't even test me. They're like, you have it. There's no question about it. You have it. So I was like, okay, well, that's that. So they're like, well, just be on the safe side and we'll test you. I tested negative.
Okay.
I tested negative, and I continued to have a high fever, a cough, and it was a really productive cough. I won't get into details for you guys, but it was pretty gross. Had horrible, horrible stomach problems. I was vomiting. Nothing I ate or drank was staying in me. Couldn't get out of bed. And here's my job saying, guess what? Your test was negative. You have to come back to work. We're sorry, but you have to come back. So I went back to work sick. And I actually continued to work sick all the way into December. And ended up testing again, I think about 4 or 5 more times throughout it, because doctors that I worked with or friends with would look at me and be like, you should not be here. You are clearly sick. You need to go home. Something is wrong. So I kept going back to the doctor, going to different doctors to try and see if maybe I could get a better answer. Maybe I'm having like some type of immune system issue. Something's going on and we didn't know what it was. Finally, again, one of my good friends who happens to be a physician said, listen, go back, demand a test, do it yourself to make sure that they're doing it correctly, and then you need to go on medical leave because you're clearly not well. Well, sure enough, that test that I did myself in a doctor's office came back positive, and not only did I get worse again, I was had to go back to work after, my 10 days of quarantining. And the day I was supposed to go back, I was walking up to my car and I just knew something wasn't right and something felt off. But again, I was being demanded to come back to work and mandated. And I said, you know what? I did this for too long. And I ended up driving myself to the emergency room and they admitted me. And I was in a full-blown cardiac dysrhythmia. My oxygen levels were dangerously low.
Which rhythm were you in, if you don't?
I was on SVT.
Okay.
I was in supraventricular tachycardia.
Did they have to cardiovert you or adenosine or what?
They gave me adenosine. I'm still in SVT. I keep going in and out of it to this day. And this beginning of this summer, there was actually discussion about possibly doing an ablation on me.
Oh, wow. Okay.
That's why I said at the beginning of the summer, I started having episodes of SVT again while at work. Ended up wearing a cardiac monitor for 5 days. Got referred to a cardiologist. He put another cardiac monitor on me for 30 days this time. And came back and then ended up putting me on some cardiac medications, which are beta blockers and dysrhythmic medications and things like that. And I have to see him again in 3 months. And if those don't help, then I'm facing an ablation.
Wow. And for those who don't know, can you explain what an ablation is?
Yeah. So an ablation is an invasive procedure where a cardiologist will basically put you under sedation. And then it's almost like getting a heart catheterization, but this time they purposely will give you medications if you aren't already in the arrhythmia to make your heart go into the arrhythmia. And then what they do is they invasively go in through your arteries and actually burn off the nerve endings of where those nerves are connecting, causing that dysrhythmia.
You're currently on medical leave right now?
I'm not currently on medical leave right now, but I was on medical leave in 2021 from mid-November all the way until the end of March.
Okay. Wow. And what did they say? I mean, so if you don't mind me asking you, how old are you?
I'm 36.
36. Okay, you're young. You're very young. Do you have any history of heart disease or cardiac issues in your family? None. Okay.
None.
What do they tell you caused the SVT?
They are saying that it could be stress-induced because I work a high-stress job, that it could be the fact that I'm female, the fact that I'm in my fertility stages, and I say that quote unquote because I looked at the cardiologist and I said, what does that have to do with anything? But they can't really say it. And then finally he came out and said that it very well could be because you were so sick for so long, and I have long haul syndrome, and that they are seeing multiple populations of people who have taken the Kool-Aid, still gotten sick, had the long haul syndrome, and are now having all of these significant various cardiac issues arise, who had absolutely no history of cardiac issues whatsoever.
This is terrifying. I feel horrible that this has happened to you. So you're currently wearing the cardiac monitor right now?
I've had to keep a cardiac monitor on since the beginning of May this year.
Wow.
I had to buy a new watch so I can do my own EKGs at home, to test what kind of rhythm I am in, because unfortunately I do work sometimes a physically demanding job, even healthcare, and I feel my heart start to race, and I flip into that arrhythmia. I have to walk myself down to the emergency room and admit myself. Well, I can't admit myself, but let them know, hey, you guys, I'm in a really dangerous arrhythmia. I need you to give me adenosine and or cardio here at the spot.
And for those of you who are listening to this and you don't know what adenosine is a very, very interesting drug. I'm sure I do have a healthcare background from back in the day, but I'm pretty sure you could explain what it does much better than I could.
So adenosine is a cardiac medication, and basically what it does is not only is it an antidysrhythmic, adenosine literally will stop your heart. It stops your heart for the split second to where it allows your heart to kind of stop and then re-jumpstart itself. And the hope is that when it stops and your heart stops beating, and when it restarts, it'll restart back in a normal rhythm. So it cuts off that electrical conductivity in your heart that is kind of sending you into that arrhythmic message and that dysrhythmia, and then when it restarts, it kind of goes back to normal. It's almost like resetting a piece of technology where you turn it off, you unplug it, you give it a minute, then you reboot it. That's exactly what adenosine does to your heart.
And the only reason I'm asking you this is because I've administered adenosine back in the day, and I know you've administered plenty of adenosine, but from a patient point of view, what does it feel like? Because I've seen the look on patients' faces when you give it to them. What does it feel like when you get hit with it?
It is, how do I describe it? It is probably one of the most terrifying feelings in the world. Because you go from having this insane heart rate where you feel like your heart is racing out of your chest, you can't catch your breath. It's almost like a panic attack you can't control and you can't down from, to feeling everything just stop. Then all of a sudden you feel like your entire body shuts down. You don't feel like you're breathing. You don't feel your heart beating. It's insane. It's almost like taking a 250-mile-an-hour car and just pulling the emergency brake on it. It's a very scary, terrifying feeling to have to go through.
And just to reiterate, these issues have never, ever happened to you before the Kool-Aid, right?
Never.
You've been in perfect health, other than, normal cold and flus that everyone always gets seasonally.
Correct. The only health issues I've ever had previously were a sinus infection between spring and winter and fall and winter, and that was it.
Wow.
And I think that's probably 95% of people out there.
I don't know if you work for a doctor's office or a hospital. I'm assuming it's a hospital. Let's suppose they were to mandate another dose of the Kool-Aid or face termination. Would you do it again, or what would you do?
I would immediately start seeking employment elsewhere.
Okay. And have they changed their policy? Are they still requiring it?
They are no longer requiring it. Some facilities are. However, shortly after the facility I was working at the time was mandating it, all of the hospitals in the system, all the hospitals locally and hospital systems within my area were mandating it. And I will tell you that it was detrimental to patient care at the time, just because they lost so many employees. I also think in our particular area, geographically, they realized also that they cannot no longer mandate it. They would have to close down the hospital systems just due to the fact that once they did start mandating it and seeing the effects that it had on the employees that were taking the Kool-Aid, and after receiving it, how many of us, and I hate to use the word dropping like flies, whether it was due to health conditions that we developed afterwards, chronic health conditions, chronic mental illness problems, failure, like people's marriages were ending, and a lot of people who did not want to accept it straight up just left the healthcare industry and went and found employment elsewhere.
So basically, for the people who were mandated to take it, like you, oh well, tough luck, huh? It's just like, you took it, congratulations, you were a good soldier, you're sick, and you have problems now, better luck next time? That's kind of the attitude?
Pretty much. I can tell you it was so bad to the point where human resources had to get involved with my position, because when I was home on medical leave, we had the National Guard at the hospital that I was working at the time helping out, because we were so short-staffed due to the nursing staff and other facility staff being completely out with either the illness or because of illness due to taking the Kool-Aid, that the National Guard had to come and actually support us during that time. So I was being mandated to return to work. However, there was no way I could return to work. I was home on a heart monitor, on oxygen, with my hospital that I worked at every day, 4 times a day. I would have to sit in front of it, take my own blood pressure, take my oxygen. And there were times where I would literally just get up to walk to the kitchen and get a glass of water, and they would call my cell phone and ask me, "What are you doing?" And I would be getting water. And they would tell me, "Your heart rate's in the 180s. You need to sit back down. We're going to call an ambulance to come get you."
Wow.
So it was a very, very scary time. And, people don't realize that working in healthcare during all that, it wasn't a joke. And the long-term effects of taking it and accepting that Kool-Aid, it's going to live with us forever. And it is one of the absolute biggest regrets of my life.
Well, I am so sorry that happened to you. I can't even imagine what it would be like having a heart rate of 180. I mean, if I'm working out super hard, doing really intense cardio, I've gotten my heart up to I think 172 is the highest I've ever gotten it. And I started feeling the tunnel vision and the lightheadedness. And you immediately know to back down a little bit and get the heart rate back down to 155, 160. And I couldn't even imagine 180. That just blows my mind.
Well, the thing that I realized I was going back into it is actually funny you say that, is I was doing my rounding in the hospital, and I was with my colleagues, and we were walking around, and we take the stairs, and I was walking up some stairs, and it wasn't even like I was walking up a lot. I was walking up just maybe 2 floors up, and all of a sudden I blacked out because I don't remember what happened. The next thing I knew, I had my vision came back, and they were like, "Are you okay?" And I'm like, "What happened?" You really don't know. And at first you're embarrassed because you're like, "Did I fall? Did I hit my head? Did something happen?" No, my heart rate had spiked up so high again. I had blacked out just walking up 2 flights of stairs.
Wow. And I've said this before, and I'll say it again. As an airline pilot, I regularly fly with 3 different first officers who fly with chest pain on a daily basis. And it's heartbreaking, and they're young. They're, to be quite frank, they're your age, and they're certainly, one of them is younger than you, the other one is about your age, and the other one is in his early 40s. And these are people that have 25, 30 years left of their career, and if they say something, it could be the end of their livelihood. So they've confided in me because they know I would never divulge their identity to anyone, and because that's just the man of integrity that I am. But they also know that I'm heavily involved in researching a lot of the damages that this has done. And of course, my advice to them was they need to get checked out, but I also understand why they're afraid to get checked out as well, because you know as well as I do, we all have families, we have spouses, we have children, we have mortgages, maybe a car payment, bills to pay, got to keep the lights on, and you lose your livelihood, you got nothing left.
Yeah, it was a very, very scary time. Now we will never forget. There would be nurses just sitting around at nurses' stations crying, and people would be getting emotional. People in environmental services, security officers, administrative workers. It was a very stressful and emotional time because a lot of people did not want this, but felt like everyone is already struggling financially right now. What are we going to do if we lose our job? How do we explain that? Do we comply with what they're forcing us into, or do we lose everything? Do we give up everything? Do we risk our employment for this?
So what we're listening to here is the untold story of what has happened to many, many, many of our healthcare workers that nobody wants to talk about. This is the story that very few people have the courage to come forward and to discuss. And I thank you for doing that, and I admire your candor and your honesty. Many people that will be listening to this obviously know your husband very well, and you know, it's a very tight-knit community that we're in, and I feel horrible that you have to go through this. It sucks, but you know, I hope that you can find a way to get over some of these healthcare issues, and you're not stuck living with this.
That is the goal that I'm working towards currently. So I know, unfortunately, during my time as like a critical care nurse and things of that, before any of this happened to me, and I hate to say the older population, but it is true that we were seeing so many new patients come in with extreme cardiac health concerns after taking the Kool-Aid, and they did not have good outcomes. And you're seeing more and more people, athletes, people in Hollywood, people of high stature. All of a sudden, now all these people are passing away. And a lot of times it's from undiagnosed cardiac concerns. And you have to kind of sit there and ask yourself, if they had no cardiac history, what else was it?
And obviously this is just pure speculation. Again, it's not medical advice. But what do you think, if you had to speculate, is the cause of all of the myocarditis and pericarditis and even a lot of the clogging of certain arteries and leading to CVAs and all types of other neurological issues? What is it specifically? We know it's the Kool-Aid, but what is it inside of the Kool-Aid?
To be honest, I can't answer that because I really don't know. They have kept, I guess, I don't want to call it the ingredients, but if everyone remembers, so when it first came out, it wasn't a live Kool-Aid, if that makes sense. It was almost like, I'm trying to explain this in a good way, like the powder of the Kool-Aid, you guys, like it was still in the packet. So I don't think it's necessarily just one piece of it. I think it's a combination of things, and I don't honestly even know if they know what's in it, to be honest.
Is there have you seen the actual boxes that it comes packaged in? Have you ever seen that? Is there like an ingredient list or anything, or?
I have, and you know what the funny thing is there really isn't. So, I mean, being in healthcare, I've administered flu shots, pneumonia shots, all of it. And the things that those look like, those particular items look like, don't look the same as the boxes that these come in. They're very plain. They have just the manufacturer, the name of the company, the dosing. There's not a whole lot of information. And when you receive other types of items, you normally get like a booklet with like all the information about it, the ingredients in it, how it's prepared, etc., etc. None of this came with any of that.
Wow. So it's not like any other vaccination, that like your flu vaccine or your standard conventional MMR vaccine or anything like that. There's no ingredients list.
No.
Wow. So I had heard that. I had heard the rumor that was the case, but you're the first person to confirm that I know of to actually confirm that. That's interesting.
And I can tell you from firsthand, because before it was mandated, they were having the ICU nurses pick up extra time working the clinics where people were coming in to get them from the public. So we were preparing them, getting them ready, administering them to people. I never had to do that. I was always kind of just either the one timing them and observing them after receiving it, or, checking them in, filling out cards, things of that nature. But I know other people had told me, and I've seen them firsthand. I've seen the boxes, and I can tell you, I've watched them be drawn up and prepared, and there's no ingredients list. There's nothing.
Did any other healthcare workers find that odd?
Oh, tons of us. So many of us.
Wow.
So many of us. I can tell you, I know off the top of my head now, I can probably give you 10 or 12 nurses that I was good friends with that were phenomenal nurses who, when faced with having to either take it or to face termination, they immediately gave their 2 weeks notice.
Well,
and they
when
completely left healthcare.
When they were talking about mandating it for airline pilots, at my airline, I was one of probably about maybe 100 pilots at my airline that was willing to stand on that hill and die on that hill. I would never have quit. I would have made my airline fire me. I would have forced them to terminate me, and I would have sued the ever-living shit out of them.
That is what I wish I would have done.
But, well, I mean, in all honesty, this was obviously a very interesting thing that blindsided a lot of Americans in the entire world right out of left field, right? They came out, they said they have this novel virus. They say it's killing people. Even President Trump went on the news and he's sending all kinds of ships to New York City to be turned into hospitals because there's just supposed to be bodies dropping like flies from this new novel virus. So the fear factor that they implemented before rolling out the Kool-Aid was insane. I mean, they terrified people with the hype.
That is where I will actually go ahead and share another thing with you that I found so incredibly ironic. Was in all my years of being an ICU nurse, and I worked in a level 1 trauma center as a level 1 trauma nurse, leading up to, that month where everything just kind of shut down and the U.S. started shutting down, it was like the calm before the storm. It's like healthcare administrators knew what we were going to expect, but I will tell you this. Was the virus bad? Yes. But it was nothing different than what we saw with people who came in with a generally bad flu or bad pneumonia. The people that I've seen have the worst outcomes were typically the people who already had underlying significant comorbid health concerns.
Sure.
heart failure, diabetes, and I'm not talking just like diabetes. I'm talking like end stage where their blood sugars were completely uncontrolled. All of that stuff. And for 2 years, almost 2 years that I worked with these patients coming in and out every single day who had the virus, never once did I get sick until after I took that Kool-Aid.
Well, like I said, Mrs. Silver and Cigars, I am so very sorry that you're having to go through this right now. And I truly thank you from the bottom of my heart for coming on and telling your story. And I wish you lots of success and lots of good health and best wishes getting through this ordeal that you're dealing with right now.
Thank you so much, and thank you so much for having me. I think it's super important what you're doing and getting the word out there and being open and honest with people who probably may be swaying one way or the other, but if they can hear the truth from someone who has lived it and experienced it firsthand, then I think if I can change one person's mind, then that's for the best, because one person can make a world of difference in other people too.
I agree completely. Thank you so much again, Mrs. Silver and Cigars.
Thank you so much for having me. I really appreciate it.